our Snellen chart. We start by doing an inspection of the overall skin of the head, face, neck, anterior and posterior chest, and the abdomen. The skin is dry, intact, color is normal for ethnicity. I don't see any edema or erythema, no lesions, bruising, scars, or nevi. Then we're going to inspect the head. It's normocephalic, midline, and symmetric. We're going to palpate the head and scalp. We don't have any bald patches. The hair is brown and soft. I don't palpate any depressions or see any infestations. We're going to palpate the temporal arteries for tenderness. Any tenderness?
No.
Then we're going to palpate the lymph nodes. We start with the occipital, post-auricular, pre-auricular, tonsillar, posterior cervical, anterior cervical, submandibular, submental, and supraclavicular. Then we're going to assess cranial nerve 5, which is the trigeminal nerve. If you could clench your jaws for me, we have good muscle tone. Then we're going to test the sensory portion. If you close your eyes and tell me if you feel sharp or blunt tip.
Blunt. Sharp. Blunt. Sharp. Blunt.
Now we're going to assess cranial nerve 7, which is the facial nerve. If you could raise your eyebrows, smile, frown, pucker your lips, and puff your cheeks. Then we're going to assess for TMJ. If you could open and close your jaw. I don't feel any crepitus or clicking. There's no tenderness. Then we move to the ears. We're going to inspect both ears. They're symmetric and in good position. We're going to palpate for any tenderness or masses, any tenderness through the ear.
No.
Then we're going to inspect the auditory canal and tympanic membrane with the otoscope. The tympanic membrane is translucent and pearly gray bilaterally. Now we're going to assess cranial nerve 8, which is the acoustic nerve. We're going to start with a whisper test. If you could cover that ear and repeat what I say.
4AB.
Other ear.
7A9.
And then we're going to do the Weber test. If you could tell me if you hear the vibrations equally on each side.
Yes.
And now the Ryan test. If you tell me when you no longer hear the vibrations.
Now. Now.
And air conduction, should we go to the bone conduction?
Now. Now.
So cranial nerves 8 is intact. And then we're going to move to the eyes. We're going to inspect the eyebrows, eyelashes. The sclera is white. The conjunctiva is pink and moist. I don't see any lesions or discharge. We're going to assess cranial nerve 2, which is the optic nerve. If you cover your left eye and read the Snellen chart on the wall, the line closest to the bottom, you can see clearly.
OVAET.
And the other eye.
OVAET.
And then with both eyes.
OVAET.
Now we're going to check central and peripheral vision. If you cover the same eye as me, then tell me how many fingers I'm holding up that move in your head.
2, 1, 5.
Other eye.
4, 2, 5.
Now we're going to check peripheral vision. If you tell me when you see my fingers.
Now.
The other side.
Now.
Now we're going to check cranial nerve 3, which is the oculomotor cranial nerve. Our pupils are rounded and reactive to light bilaterally. We're going to assess for accommodation and convergence. If you could focus on something behind me and then watch my pen run all the way to your eyes. Good. So cranial nerve 3 is intact. Now we're going to assess cranial nerves 3, 4, and 6, which are oculomotor, trochlear, and abducens. You could follow something like that moving your head. So there's no evidence of extraocular movement. Now we're going to look into the eyes with the ophthalmoscope. We're looking for the red light reflex, which is present in both eyes. Now we're going to move to the nose. The nose is midline and symmetric. We're going to assess cranial nerve 1, which is the olfactory nerve. If you close your eyes and smell this.
Sharpie marker.
Correct. And that also verifies that our nerves are patent. We're going to palpate the maxillary, infernal sinuses, and tenderness.
None.
And then we move to the mouth. We're going to inspect the lips, teeth, gums, posterior pharynx, the tonsils are grade 0 because they're not present, and the tongue, under the tongue, the salivary glands. And then we're going to assess cranial nerves 9 and 10, which are glossopharyngeal and vagus. You can stick your tongue out and say ah. We have upward rise of the uvula. We would also test the gag reflex for cranial nerve 10. Then we move to cranial nerve 12, which is the hypoglossal nerve. If you can stick your tongue out, move it up and down and side to side. There's no fasciculation. Now we're going to move to the neck. The trachea is midline. There's no deviation. We're going to palpate the thyroid gland if you could swallow. And swallow again. Don't palpate any masses, any tenderness with that.
No.
We're going to palpate the carotid arteries. We do this one at a time. Now we're going to auscultate for any carotid bruits. We do that with the bell of the stethoscope. No bruits are present. So now we're going to move on to the range of motion of the neck. If you could do flexion down, extension, hyperextension, lateral flexion, and then lateral flexion and rotation. And then if you could shrug against my hands. That tests cranial nerve 11, which is the spinal accessory muscle. Now we're going to assess the posterior chest. We're going to inspect for any signs of respiratory distress. I don't see any accessory muscle movement, no tripod positioning, nasal flaring, dyspnea, tachypnea, or cyanosis. Our back is symmetric. I don't inspect any deformities. I'm going to palpate for any masses or tenderness. Going to palpate for equal chest rise and fall. Turn this way for me. And we have equal chest expansion. Now we're going to palpate tactile firmness. If you'd say 99 each time you feel my hand.
99, 99, 99, 99, 99, 99.
And then we'll percuss in the intercostal spaces. We should hear resonance throughout. Now we're going to auscultate all the lung fields. First with the diaphragm. And then again with the bell. Now we're going to test for lung consolidation. If you could say 99.
99, 99, 99, 99, 99, 99.
test for egophony. Now we're going to do whisper. If you could whisper 99. 99. Then we're going to test for bronchophony. If you could say E.
E. E. E. E. E. E.
So there's no evidence of, all the tests were negative, there's no evidence of lung consolidation. We're also going to make sure to get our medial lobes. And then we move to the anterior chest. We're going to inspect for symmetry. There's no deformities. We're going to palpate for equal chest rise and fall, which is equal. We're going to palpate for tactile firmness again. If you'd say 99.
99. 99. 99. 99. 99. 99.
Okay. Now we're going to auscultate in the anterior lobes. First with the diaphragm. And with the bell. Now we move to the heart. We're going to auscultate over all of the valves. We start with the mitral, the aortic valve, which is the second right intercostal space, the pulmonic, which is the second left intercostal space, third point, which is third left, tricuspid, which is fourth left, and the mitral, which is the fifth left. We're going to auscultate again with the bell. We're going to locate the PMI, which is over the fifth intercostal space, and then we auscultate the apical pulse for 1 full minute. We have a rate of 70 and a regular rhythm. Ask you to lie down. I don't inspect any heaves or lifts. I don't palpate any thrills over any of the valves. Then we auscultate again with the patient supine. Start with the aortic in the second right intercostal space, pulmonic in the left second intercostal space, Erb's point in third left, tricuspid in fourth left, and then mitral in the fifth left. And then we auscultate again in response with the bell. Now we're going to move on to the abdomen. Our abdomen is flat and symmetric. We're going to auscultate for any bruise over the aorta, the renal arteries, iliac arteries, and femoral arteries. We do that with a bell. Now we're going to auscultate for vowel sounds in all 4 quadrants, starting in the right lower. No vowel sounds are normal active. But then you're going to percuss in all 4 quadrants. We should hear timpani throughout, except over the liver and spleen. We should hear dullness. We're going to palpate for any masses or tenderness. Any tenderness?
No.
We're going to palpate in the right upper quadrant for the liver, in the left upper quadrant for the spleen. Any tenderness with those?
No.
I don't palpate any masses. You can sit up now. We would assess for JVD supine and 30 to 45 degrees, and JVD is absent. Now we're going to assess for CVA tenderness. Any tenderness with that?
No.
And now we move to our upper extremities. We're going to inspect the joints of the hands, the fingers, wrist, elbow, shoulders. There's symmetric, no deformities. I don't palpate any edema or see any erythema. There's no crepitus or nodules. The skin of the upper and lower extremities are dry and intact. I don't see any deformities or lesions. There's no edema or erythema. I'm going to test for capillary refill. It's less than 3 seconds. Our radial pulses are 2+. Squeeze my fingers. Hand grips are 5 out of 5. Now we're going to do range of motion of the fingers. You can make a fist, and then extend out, hyperextend, flexion, extension. So fingers spread out is abduction, and back in is adduction. You can move your thumb to pinky, thumb opposition, and then we go to range of motion of the wrist. We're going to flex down, palm up, extension, hyperextension, and then we move our hand towards pinky is ulnar deviation, towards thumb is radial deviation, and then rotation. And then for the elbow, we do flexion, extension, hyperextension. And the shoulders, range of motion of the shoulders, we flex up, extend, hyperextend, and then arms to the side is abduction, back down is adduction. You can grab your hands behind you. This is internal and external rotation, and then make the circles is circumduction. We're going to test bicep and tricep strength. If you could push and then pull, and then shoulder, girdle, and push. So both of those strengths are 5 out of 5. Now we're going to test the sensation of the upper and lower extremities. If you close your eyes and just say here when you hear me touch.
Here, 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 here.
Now we're going to check the vibratory sensation. We do this over the ulnar prominence, as well over the medial malleolus. You feel the vibrations? Now we are going to test for stereognosis. If you could close your eyes in your hand. Can you tell me what this object is?
It's a Sharpie marker.
Correct. And keep your eyes closed. We're going to test for graphaphasia. What number am I drawing in your hand?
3.
Correct. Now we're going to do our cerebellar test. First, if you could take each finger and touch to your thumb. Now place your hands palm up and rapidly flip them back and forth. Now take your finger and touch your nose to my finger. Okay. Now we're going to do our deep tendon reflexes. Start with brachioradialis, biceps, triceps, and again, brachioradialis, biceps, triceps, and then we do, if you could scoot back, we'll do patellar, and then Achilles, and then we test the Babinski reflex. So all of those reflexes are reactive. Now we're going to move to the lower extremities. We're going to palpate the joints of the toes, ankles, knees, and hips. They're symmetric, no deformities, no edema or erythema is present, no nodules or crepitus. We're going to assess for capillary refill. The toes is less than 3 seconds. Dorsalis pedis and posttibial pulses are both 2+. Now we move to range of motion of the toes. You can flex them down, extend back up, spread them out. It's abduction and back together is adduction. Now our ankle, we plantar flex down, dorsiflex up, And if you could place your feet flat on the floor and roll them towards your big toe, is inversion. Now towards pinky toe is eversion. And then rotation. Now we're going to test strength of the knees. If you could push and pull and push and push. Good. So both of those are 5 out of 5. You can stand up for me. We're going to do range of motion of the hips. Flex up, extension, hyperextension, flexion, extension, hyperextension. And then we do abduction away from the body, adduction back 2, abduction, adduction, circumduction, other foot, and 90-degree angle in, back is internal and external rotation. And then range of motion of the knee. You could bend it behind you, flexion, extension, hyperextension, flexion, extension, hyperextension. And if you could bend over and touch your toes. This is flexion of the spine. We're assessing for any scoliosis. Our spine is straight. There's no deformities or curves. So like I said, this spinal flexion. You can come back up, extension, hyperextension, and then bend to your side, lateral flexion, and then rotation if you could twist. Now close your eyes and put your arms out in front of you. This is the Romberg test. We're assessing for any swaying, which is not present. Now if you could take a few steps out in front of you and walk back heel to toe. So our gait is normal, and then if you could hop on each foot. And that concludes our head to toe.